My name is Dr. MaryAnn Pladdys. I'm an audiologist and my office is in Livingston. I've been an audiologist for 32 years. I've worked in many different settings, from hospital settings to ear, nose, and throat practice settings to private practice. And I decided that my own private practice would be the best way that I could help patients the way that I like to help them. My credentials let people know that I am fully trained in the field of audiology and fully licensed in the state to be an audiologist as well as a hearing aid dispenser. This is important because I have the knowledge and the training to provide the best services that I can for my patients. I became an audiologist because I enjoy helping people, and people come to me with a problem, and through testing and looking at the results, we come up with a solution so that they can hear better and enjoy their lives more. Many people identify that they have hearing loss but don't admit it. Studies show that it takes 5 years before people actually do something about a perceived hearing loss. They think that people are mumbling, they think the TV is not loud enough, they think that people shouldn't speak to them when they're turning around and walking away or while the water is on. Those are signs of hearing loss. So audiologists test hearing, dispense hearing aids, but we also test for balance disorders and also other disorders of the auditory system, such as tumors or other things that might possibly be going on in the auditory system. Today's technology can be quite loud. People enjoy loud music, loud video games, loud movies, loud TV shows, and don't realize how loud they are. We are seeing people younger coming in with hearing loss due to concerts, due to the headphones and we live in a noisy world, and people are coming in a bit younger than they did when I first started. A lot of my patients back then were people over 60 years old, and now people who are in their 40s are coming in and looking for help for hearing aids. I think a lot of that is that they are becoming a little more mainstream and accepted. Also, the new hearing aids look like Bluetooth devices that sit behind your ear, so I think people are a little more accepting of having something sit behind their ear. So the process begins when a patient comes in and we discuss what difficulties they're having with their hearing. Many times it's trouble in noise, hearing their spouse in the home when the TV is on or when the water is running and they're trying to have a conversation and they notice that they're not hearing as well as they used to. So we test their hearing and discuss the results. And when there's hearing loss, discuss the type of hearing loss, the amount of hearing loss, if anything, and what solutions are available. For many patients, there are a couple of different solutions. It's not one particular thing that is best, so the patient has choices, technology levels, sizes, colors. They actually come in different colors. If you want a bright pink hearing aid, you can have a bright pink hearing aid. We're seeing a lot of people who work in construction, who are using heavy equipment, come in with hearing loss, manufacturers who also are making things and using loud equipment. We'll see some healthcare professionals, even dentists, even though those drills are not loud per se, the high-pitched sound of the drill will give them a noise-induced hearing aid. One patient that stands out was a woman who was in her 80s, and she came with her daughter, and I fit her with hearing aids, and after several months she came in for a follow-up, and her daughter was in tears because her mother, previous to wearing hearing aids, was very withdrawn and didn't communicate with her family. But the hearing aids gave her the ability to communicate, and her whole affect changed. She participated with her family. She was able to speak to her grandchildren again. And she was even playing cards with her friends again, which she hadn't done in many years. So things like that are what drive me to do what I do, because it just helps people change their lives. If you or someone you love might have hearing loss, stop in, schedule an appointment. I'm happy to help.